This is what your blood looks like after that fast food meal as you roll through the Golden Arches or go to Burger King or Taco Bell or Kentucky Fried or whatever. And I'm not just picking on those. Most of the meals that we eat will cause this. That turns your arteries into this, arterial sclerosis. Ugly, isn't it? Now this is what a beautiful artery looks like. And this is about 70% blockage. We've got a calcium deposit. We've got some plaque buildup. We've got inflammation. You know what your symptoms are at this point? Absolutely nothing. You feel fine. You're living your life like vida loca. Nothing's going to stop you. And right there is the American tragedy. Now, standard medical treatment is failing and failing big time. What is standard method of choice? Well, it's either drugs or surgery, or as I like to say, Drano or Roto-Rooter, because doctors almost treat you as if you were a clogged sink. First they try the Drano or liquid plumber or Coumadin or some of these drugs to see if we can clean it up. If that doesn't work, then we're going to put the old snake down the drain and you know, try to unclog it. Well, they shove a catheter up your groin and do a balloon stent or bypass. But these methods are failing, and they're failing big time. Well, guess what? Here's some new technology that those cardiologists were talking about. It's called the Digital Pulse Wave Analyzer. It's FDA cleared, which means they investigated it for what it's designed to measure. It actually measures, and it's a Class 2 medical device, which means non-invasive. What does it do? It takes a snapshot of your arteries, tests your heart rate, heart strength, artery flexibility, artery blockage, hydration levels, and overall cardiovascular health. Best of all, it's quick, affordable, painless, and reliable. This simple test in 60 seconds performs the same operation as 7 other devices: an electrocardiogram, an echocardiogram, a duplex Doppler, a pulse oximeter, a cardiovascular profiler, a heart rate variability, an augmentation index, as well as an MRI. In a hospital environment, this would cost you somewhere between $2,500 to $5,000. Yet this test does all these tests in 60 seconds. And what's nice is you get a report right on the spot. You know, Lifeline Screening, which is out there, does an echocardiogram, and what they're actually, you have to wait 14 to 21 days to get your results, and then oftentimes you have to set a doctor's appointment for him to interpret it. Well, we have highly trained technicians who give you your results right on the spot. You don't have to wait. We'll show you your pulse rate, your heart rate. We'll show you your blood viscosity. The thicker your blood, the higher chances of having artery disease. Your ejection time, which is equivalent to ejection fraction, or how strong your heart is. We'll look at elasticity of your aorta, which is flexibility of your largest artery that comes out of your heart where the blood flows, as well as arterial sclerosis, the hardness of the large and small arteries, and atherosclerosis, or plaque buildup in your large arteries, as well as any inflammation in your small arteries and capillaries. We will grade you from A to G, A being excellent and G being Bill Clinton. Now, why did I say that? Because Bill Clinton has the best doctors in the country. When he was president, he went through a battery of tests. It didn't cost him a penny. And guess what? They said, you are good to go, Bill. And he went. And the very next day, he started having chest pain while jogging and ended up with a triple bypass. All those tests missed it. However, this cardiovascular screening device would have told him he was a clinical event.